Hello, everyone. It's Georgie from Authentic Self Compassion. Thank you all for joining us tonight. So nice to see some faces here, and we just had a few laughs here, so that was great. And we have Shelly Prosko joining us today, and she's going to be sharing with us about yoga and science within the pain care and pain management. And you do have a chapter here, Shelly, on compassion and pain. And so I'm hoping that we could talk about that, but I'm also hoping we can learn about yoga and pain. So welcome, Shelly. And
Thank you.
yes, so nice to see you. And we just learned that we're not too far away from each other. So great to have you on our show.
Yeah, well, thank you. And we already said quite a bit before the recording started, but I'll just repeat. It's a pleasure to be here and an honor. And I'm not saying that lightly. I know that's what we all say after, but I'm really excited. Thank you. And I can't wait to dive in and get all the questions after too, if there are any.
Yes, for sure. So yeah, you can start wherever you'd like. If you want to start with a book or just, or just tell us a little bit about yourself and your journey and how
Hmm.
it all came about.
Okay, let's see if I can keep it a little concise. Sometimes I get really excited about talking about myself and it can go on. So let's start with, let's see what might be. Well, maybe a lot of people seem to be interested in how does a physical therapist, so I'm a physical therapist and a yoga therapist. So some people find it sort of interesting. How did you come about blending the two? So maybe I'll just start that. It gives you a background of where I'm at, and then you'll see how the yoga came in and the pain. But maybe we'll start with that. And
Sure.
so let me go back to around, I think it was around 1990. And I found a yoga book in my sister's bedroom. I was stealing her clothes. I always would borrow her clothes. She'd get really mad at me. She's 2 years older. And at this point, I'm 18, 17, do the math, 18. So prime, right? For wearing your sister's clothes and
Sure.
stuff. Anyways, I found this book. It was a just a written book with had some pictures in it. And it was on yoga. So that's my first recollection of yoga. Maybe there's something before that, but that's what stands out. And I started reading it, and I'm going to admit to everybody here and everyone watching the recording, I was interested in it because, well, it's just yoga. It looks interesting. My sister was doing it. Always really admired my sister and, kind of wanted to do what she did. So there was a bit of that. But, to be fully honest, at that time, if anyone remembers, around 1990, celebrities were doing yoga. Madonna, Sting, and they were making it popular and mainstream. So I'm admitting I was a Madonna fan, and I thought, well, she does it when that's peaceful and fit. And so that's how I started. It was more for the physical though. And then, so that was through the 90s. Well, I'm from Saskatoon, Saskatchewan. There was a beautiful studio there, a yoga studio. And this is before yoga was really popular. Like now there's yoga studios all over the place. So there was just one in Saskatoon. It was a very traditional, classic yoga studio. And I practiced, like I said, for the physical. And I mean, the rest is history as far as my yoga journey because I started feeling better, yes, physically, but even little things like that was the time I was in university. Like my migraines were getting better, my digestion, I just felt better. I might say that I felt a little more peaceful, but I don't know. I still had quite a bit of anxiety, but just overall, it was just, I felt great. I loved it. So I did that and I got into physical therapy school at the U of S in 95. So I had a physiology degree. I went to the U of S early in the 90s, got a physiology degree, got into physical therapy, did that. And there's no real aha moment when I started blending yoga and physical therapy because the yoga kind of came first and it just sort of became a part of me. So I couldn't really separate it. But I go through PT school, get my degree, start treating patients. I started in long-term care and then I went to outpatient orthopedics. So now I'm in a private setting working with musculoskeletal injuries, you name it, right? Back, shoulders, knees. Did that for about 14 years. And I guess it's on that journey from when I graduated from PT in 98, I was still doing my personal yoga practice. It was growing, it was evolving. I was learning more about yoga philosophy. I was learning more about breathing, and all of these things were just infiltrating my clinical practice very naturally. I just pick a pose, or I'd pick a breath practice. I was just making it up as I went along. So I was doing traditional physical therapy in the clinic, and I would always struggle though with how can I do more? There was something to this yoga thing, and it's helping, and it was helping me personally. And I was like, how can I bring it in more? But the healthcare system and even today, the way it's set up, it's not conducive to, really bringing in this yoga approach. And so I was always makeshifting, and it's such an interesting story how, like, every time I'd go to a new clinic, this is what I do. I want to do this. And so I'd have to move the tables and get the curtain. And, like, it was always makeshift. And eventually I went out on my own around 2013, 12. And that's when I kind of quit the whole healthcare system. I said, I can't just do this anymore. I have to do it my way. And so for that many years now, I've been on my own, and I blend. I call it physio yoga. It's just a brand, but I'm still a physical therapist. I do what I do, but it's a really different approach. I bring in yoga philosophy and yoga practices, and mostly, as you know from the book, thank you for sharing that, mostly I work with people with chronic or persistent pain. I work with other things too, like I'm a pelvic health professional, so I work with people that have pelvic health issues. But I think here we're really talking about, maybe we'll get into pain, but really, so this is self-compassion. And like you said, I have a chapter in the book on compassion, so I'm happy to dive into that. But I feel like I've been talking a lot there. So maybe I'll pause, Georgie, just to see. I can keep going, but I'll pause and see if you want to continue with my story or go into something else, or if you have any questions.
Yes. So if anybody has any questions, just put up your hand or just ask your question in the chat as well. I think we're good to carry on there, Shelly.
Good. Yeah. Yeah. I'd rather get into, some of
Yeah.
the other stuff than my background.
Yes.
So did you want me to just continue on with whatever
Yes.
you want, sort of thing? Okay.
Yeah. Please.
So, so what I will then get into maybe is how the book and how compassion came about, because that's usually people tend to be interested in that. And maybe I will start with the book part.
Sure.
So this book, I have it too, and it's a collaboration.
Mhm.
So it's something that I co-edited and co-authored. So I hope I didn't say my book. So it's not my book, it's our book. And it's co-edited by two other physical therapists and yoga therapists. So Neil Pearson is another fellow Canadian. He is originally from Ontario, but relocated to BC a long, long time ago. And he's a associate professor at UBC in physical therapy. He's done some research as well. And he started meditating first, like I think in the 80s, maybe even 70s. And so he's been doing this longer than I am. He's a bit older than I am. And it was really through him, it was around the early 2000s when I felt really alone, like no one's doing this, integrating this yoga and physical therapy. And it was an article in our Canadian Physiotherapy Association magazine on yoga for pain. And it was Neil Pearson. And I have to know him. There's another physical therapist, that knows about yoga. So reached out to him, and one thing led to another. And of course, we just became really close, like colleagues, friends, and I've learned so much from him. But he was the one, I will say, that really introduced me to this idea of bringing yoga, like specifically yoga practices and principles, into pain care and into aligning it with the science around pain. So there's this industry, if you will, or area of, we call it pain science. It's really just all of the science around pain, right? Like you would talk about compassion science or any other kind of science. There's pain science. And it's a huge area, you can imagine. There's all kinds of things are studied. And so Neil was the one that really introduced me to how yoga principles and practices align like perfectly with what the current pain science is telling us. And the pain science has evolved drastically within the last 25 years. And the way it's evolving is it's yoga. it's it's kind of interesting, what these ancient wisdom traditions, what yoga tells us about people, about pain, and just about what yoga is all about, which I'll share. It's really interesting how it lines up with our theories around pain and how it makes sense. That's why yoga can help. So that's Neil. And then with Marlisa, she is from Eastern USA. Marlisa Sullivan, she's the other co-editor. So there's the three of us. And she's a physical therapist, an associate professor at a couple different colleges, universities down there, and a yoga therapist. And I met her maybe 15 plus years ago at these yoga therapy conferences, these international conferences I was going to and starting to speak at. And that's how I met her. And so she's also just same thing. She was like Neil and I working in with yoga, physical therapy, and pain science. I'll stop there as far as how the book came about. I think that's just details. But basically you can imagine just being in those circles with the two of us. We're like, yeah, let's do a book. Although I will say with the book, one thing that was missing. So the three of us teach yoga professionals how to be more pain informed. Okay, because there's a lot of outdated views about pain, and that can really have a negative effect on people's pain and their outcomes and their ability to recover if we have outdated views. So we really love bringing this into yoga therapy trainings and programs to help these yoga professionals be more pain informed and teach in a way that's in line with what the science is telling us about pain. So we all three of us were doing that. And we love doing that. And that's part of why we wanted to write this book, right? For them. But then there's another population. Well, there's a couple more populations, but the other one are the healthcare professionals, specifically the rehab professionals, PTs, OTs, mental health professionals, and physicians, anyone, any healthcare professional, but really the rehab professionals who are working with people in pain. Because everybody here on the call, I think you would agree, persistent or chronic pain is very prevalent, and it's prevalent across the whole world. Approximately 1 in 5 people live with chronic or persistent pain. That's 20%. This is globally. Of course, numbers go up and down, but I mean, this is ubiquitous. And let's face it, we don't really do a good job at helping people with pain, chronic pain, right? That's why when we had the opioid epidemic, and there's still fallout from that, and there's lots of reasons that I can get into as well about why don't we? But before I get into that, is this idea of the population of healthcare professionals, physical therapists, PTs, mental health, we're all falling short. And that's, I say that as a group. And it's not because we're lazy or we suck or we don't care. It's because pain is complex. People are complex. Pain care is complex. And there was nothing out there giving healthcare professionals a tool, a framework, especially 15 years ago, on a whole person approach to pain care. And in our rehab world, we say biopsychosocial, spiritual approach, or basically biopsychosocial or biopsychosocial spiritual approach to pain care means whole person. The bio, the physical, the physiology, your body, all your systems, your immune system, your muscles, your bones, your hormonal system, like everything, your nervous system. So that's like the physical, that's the bio. And then there's the biopsycho. So then there's the psyche, the mind, the mental part, huge part of pain. And then the social part. And again, another really significant part of the pain experience. Your capacity to feel like you have meaningful relationships, your identity. What happens when pain persists, you lose a lot of that because you're hurting and your world gets smaller and smaller, and you can't do the activities you used to because it hurts, and then it just, your circle gets smaller. And then with time, sometimes even your identity changes, or you simply just you don't have your life anymore. You don't even know who you are. And like I said, relationships can change, and there's something called perceived social isolation. So you might have a lot of people in your life. You might have a spouse and kids, and you might be in a room full of your family and close friends, and you might feel still very socially, you might feel isolated, right? So there's there's some research around that we call it social isolation. Or you may have just one or two people in your life, or you may be alone in solitude and you may feel like you're really connected. So that's sort of the social part. And then the spiritual part is this idea of meaning and purpose in life, and whatever spirituality might mean to you. Sometimes it's religion for some people, sometimes it's not, right? There's no, faith or religion involved. Sometimes it's just this idea of nature or my essence, like who I am or what my meaning is or purpose. And I feel like I'm connected. It's that flow state or that space when you can't quite describe it, but you're in flow and you feel expansive, things like that. Maybe love, that's a word. I talk about that in my chapter. I think I went on a bit of a tangent there, but I know I'll circle back. Where I was going was with the book and why we wrote it, and far as the populations for the yoga professionals to learn more about pain so that they can better serve the people in their classes or their one-on-one yoga therapy clients, not doing harm by outdated views. And then also for the therapists and the clinicians. We have a framework where we can help people in pain looking at all aspects of their existence, and yoga provides that. So do you want to learn? You don't have to become a yoga therapist, but do you want to learn more? And maybe you can sprinkle in some of these practices that we teach, some of these concepts. We call it the yoga principles. There's a whole bunch of them, and it's in our language. And maybe a clinician can learn one thing that can help them in their 15-minute session with a patient. So that was the other reason why we wrote this book. Maybe we can help these traditional healthcare practitioners. And then we wrote it for people in pain as well. And we have a lot of people in pain who really value this book. So Georgie, I know you have the book and I know you just got it. And I don't know if anyone else is going to be interested, but I'm telling you, I make like 50 cents on a book. So this isn't a sales pitch. I actually think I make $1.50. So just to be transparent. But the very first chapter is called The Lived Experience of Pain, and it's by a person in pain named Joletta Belton. The book is worth just that chapter alone. I've had patients who have said that chapter brought them to tears, it connected with them, and it was saying exactly their experience that they've never been able to express into words. And I had one patient not too long ago who gave the book, but gave the chapter to their family, made some of their family members buy it, like the ones that weren't around him were out of town. And I said, you have to buy it and read chapter 1. He said, because that's me. And it was only then when his family read chapter 1 and that he really felt understood, believed, heard, seen. And so it was very validating for him. It's a beautiful chapter. But that's kind of how the book, although it's a little bit about the book, and there's other contributors I didn't mention. I write the chapters on breathing and pain and compassion and self-compassion and pain, and then I co-author a couple other chapters on yoga therapy, and then we have a few other chapter contributors they're talking everything from awareness practices, what does that mean, and the psycho-emotional component, nutrition. There's a chapter on that, which is really interesting. By the way, I just want to pause on that nutrition chapter because there's nutrition, I'm sure you all know, there's all kinds of information out there, right? And so this person that wrote the chapters, a clinician, a therapist, collaborates in research, and he's so evidence-based. So he doesn't make big claims like, oh, take this and take this. Like he really brings in, this is what the research is saying about nutrition and pain and inflammation. And he just kind of lays it there and he gives suggestions. Maybe, these are foods for inflammation that may indirectly help pain. And I mean, I won't go into that part, but I just wanted to pause there and say it's a really nice chapter that doesn't make big, bold, unsubstantiated, inaccurate claims. It's very grounded and it's practical. So that's a big one. And grief, we have a chapter on grief and loss, because a lot, like I had mentioned a few minutes ago, a lot of people where pain persists, there's so many losses in your life, and you even lose how you were before the pain. So it's not just about your function, although there are some, loss in function and that, but also, as I mentioned, like the roles and the identity and friends and jobs. And so there can be a lot of loss. And so that chapter is a beautiful chapter. And all of these chapters relate to where the yoga fits in.
Yes.
There's one on addictions. And yes, we think of the pain medications that one might be addicted to. We need that. That's how people cope and manage. So it's a beautiful chapter that doesn't vilify that at all. And it's also addictions in general. So not just to those sorts of things, but it could be to our phones or, all kinds of things. It's a beautiful chapter. The psychologist and yoga therapist, so everyone's a yoga therapist in here with a different view, a different license or professional license. But this particular psychologist that wrote about pain and addictions in yoga, she has a lot of experience in using yoga in the AA program and the 12 step. And so she does this beautiful thing where she combines yoga into the 12 step, and regardless of what kind of addiction it is. And she does also a beautiful job at, and I mean this with respect and to be inclusive of everybody, which is she does a great job of, replace is not the word. I want to be careful of my words here, but of being inclusive of all faiths. Because my understanding with that 12 step, it's based, I think how it was started was with a Christian base, or maybe I'm mistaken, but I know there's a lot of talk about divinity or God, and so she doesn't strip that away to take away from those roots, but she makes it in a way that's inclusive to, any faith or not. So even if you don't have one, she kind of brings in and parallels yoga.
Yeah. So first, if anybody has questions, just pop in. And if there are no questions, Shelly, I would love to learn more about how do you manage pain with yoga?
Okay.
I know my husband has his own aches and pains, and I have my own aches and pains. And I know he does a lot of stretching, to
Mhm.
help. I don't, but I'm willing and wanting to learn about how do you manage and care for your pain yoga.
Okay, great. Yeah, I love that question. So strap in, grab a cup of tea, and I'll make this as engaging and concise too, and useful as I can. That's why I say strap in, and this is because now you're going to learn about yoga, right? We have to understand sort of what yoga is before we can just dive in and say how does it help people with pain.
Yeah.
So let me just quickly remind you. Sometimes our understanding of pain is that it is only directly related to the tissue or tissue damage. That's one part of it. It is related to our structure, our physical body, yes. And what we know from the science is that pain it's an experience, and it's actually an output of your brain or an output of your physiology. It's not in your head, and it's not just mind over matter. That's not at all what the science is saying. But what the science does say is that it's an output, meaning the input. So you look at anything from whatever it could be, pressure, like let's say you bend your finger back, you go until you feel pain, or maybe you have something in pain in your back or in your hip, you step on your leg and your knee hurts. So any kind of mechanical stimulation, but it could be thermal stimulation as well, right? Extremes of hot or cold, or chemical. So it could be something more inside the tissues, like think of a sunburn. So basically, you have these nerves in the periphery in your body that can be stimulated by mechanical force, temperature, or chemical. Okay, that's not pain, but it can be stimulated. And it's a message then that goes up to the spinal cord. And there's lots of stuff that goes on in the spinal cord, a lot of messages dependent on your state and all kinds of things, like your mental state, the state of your immune system and hormone system, everything, before if that message is going to go further up to the brain or not. So you get the message, it's not pain, it's just pay attention. And then the spinal cord, there's some processing there. And if the whole your physiology says send that message up, it's going to go up to the brain. You still don't experience pain yet. So in the brain now, it has to make a story of everything. And so that means at this moment, whether you're bending your finger back or you step on your leg and, before there's any pain, I know it's fast, but stub your toe, paper cut, you name it. With that message now, the signal going up to the brain, message saying, well, pay attention, danger, danger. The brain now looks at how you're breathing. It looks at all the inputs. So how you're breathing, the state of your muscles, is there any tension anywhere, right? So everything, the state of your immune system, the state of your hormonal system, the state of your nervous system. So, were you in that fear, fright, flight, and all? So there's all of these different aspects that your brain is trying to assess and figure out, is this dangerous or not? Do I need to send an output to let you know to, hey, pay attention? And also, what plays in a role in this are your thoughts, your beliefs, past experiences. What happens when you usually step on that leg? What happens when you usually go to do that thing with the arm and that? So you can start to see what's happening here, right? It learns to say danger, danger. So only then, and there's like 200 to 400 areas in the brain that are involved in this. Think about that. Like, this is super complex. Pain is so multifaceted. I didn't mention also your emotional state plays a role. Now, the brain says, this is dangerous. Like, we got to alert. The output can be all kinds of things to protect you. Pain is one of them. That's what I mean when I say pain is emergent or pain is an output. Now, there's other outputs though, too. It's not just pain. That's one alarm. But think about, I'm not going to put you all on the spot, but just get you thinking, what else? What other output of the brain might try to get your attention to say, oh, maybe stop this, or oh, pay attention? Can you think of other outputs besides pain? Muscles, they might spasm because they're going to stop you from moving. And it could be anywhere. Maybe you have a long-standing back issue, back pain, and those muscles seize up. That's an output from the brain, right? It's saying, protect, gotta seize that, gotta seize those up. Muscle tension, really anywhere else in the body. Breathing. So your breath might change. That's another output. Fast, right? Because we need to run and sprint, that sympathetic nervous system. So we have lots of research that shows people with persistent pain of any kind, their breath pattern changes. It's not as deep and calm and relaxed. And so that shallow, and I mean, you're not breathing like that. That's not what I mean, but I'm just exaggerating. But a more shallow breath pattern, what does that do? That then feeds back into the beginning, the input. And then you feed into more of the threat because your whole system thinks it's on threat. Is that making some sense? See
Absolutely,
a
it
few
is.
nods, okay? And there's more. So the output, I just said breath and muscle tension and pain, but there's other outputs too. It could be anxiety, fear. That's very, very common. And then again, that fear and that anxiety, and you're not trusting your body, and rightfully so, because it hurts when you do that, or you have a flare up for 5 days after. So you're afraid. And so that fear, that's another input into that system. And then that just perpetuates and makes the body and the brain think, oh, more and more danger. And then there's other outputs, like things like muscles may give out. Sometimes people will say, they didn't even really have pain, but their muscles just gave out. And other things too, like really any aspect of your existence, like vomiting, that could be like just anything that's trying to get your attention. And so thank you for staying with me, because this is important when now we get, well, how does yoga help? You need that foundation to see, okay, well, what's this yoga thing? Do you have a takeaway from that, or any aha moments, or anything maybe you didn't know, or just something you did know and you want to highlight as well?
Well,
I'd be
I just
interested.
didn't think of the outputs, and I
Okay.
didn't think of like all of the factors that go into it. Because when I think of pain, I think, oh, geez, like my arm is so sore, and that is pain. But when you're talking about,
Right.
it's not really pain, it's the messaging from your nerves and
Yeah. Yeah. So, well, and it is pain. So
yeah,
pain is pain. I just want to make sure that, for me, like pain is pain. But here's the key takeaway. Pain is complex. Just know that, even acute pain. So next time you stub your toe or you get a paper cut, yeah, it's real, it's there, and it's from because you stubbed your toe. And it's complex. So the amount of pain you felt, okay, was that output. It was complex. There's research that shows paper cuts hurt. They're far more intense at work than they are at home. There's all kinds of fun studies, around that. If you are a violinist or something, let's say, and that's your profession and that's what you do, something happens and your hand gets caught, what the research shows is that particular person that experienced that pain might be worse because there's context around that because they've now lost, like the fear of now they can't use their hand. And that was just a quick example, but I think you get what I'm saying.
Okay.
So pain is complex. Okay, so we know that. Pain, the second thing is pain is a sensory and an emotional experience. So it's not just sensory, like you were saying, Georgie. You just think of pain and we're just so attached to the tissue and oh, it's that. But it's not just sensory, it's everything. Pain is an experience, not just a sensation. Okay, that's the second key. So pain is complex, pain is sensory and emotional. And when pain persists, every aspect of our existence changes. There are real changes. So even those of you sitting here maybe think, I'm good as far as my social circles, and it's just a niggling pain or aches and pains, like, and it's just that shoulder for the last couple of years. Or so even if you don't feel really any existential or social type changes, your brain has changed and your physiology has changed because the whole pain system is hyper vigilant. The whole pain system is a little more sensitive because it's trying to create more pain. That's what it's learned to do. So we're just reminding you that all of these different aspects, like your breath has changed a bit, the muscles tighter, weaker, not just the tissues. Sleep can change, mental health can change. And when I say that, I don't mean you necessarily have to have a diagnosis, but attention and focus. So we have research that shows when pain persists, even that irritating knee osteoarthritis or that shoulder rotator cuff, when it persists, your brain changes as such where you're less able to focus and concentrate. And what happens is the areas in the brain, they pay more attention to the painful area, and the non-pain sensations in your body reduce. So that's really important to know now when we go into the yoga, because now what yoga offers is that we can use any aspect of your existence to change any other aspect of your existence, which can influence and change your pain. So I'm going to say that again. Through yoga, it's not just the movement, and it's not just the meditation, and it's not just the breathing. Think of every single aspect of your existence. You can use any one of them or layer them all. And each one of those aspects of your existence has the capacity to change any other aspect of your existence, which can change pain. Example, often we think, okay, my muscles here are tight around my hip, and the physical therapist told me they are weak and my core is weak. Okay, you can use physical movement. You can use the body to change the body. Great. Keep doing that. But why can't we help people in pain then? Right? If it's really that simple. Well, I'll go back to point one, which is because pain is complex, especially when pain persists. The whole physiology changes. So yes, you can use the body to change the body. Keep going, keep doing it. Let's say you have some anxiety or fear, and well, you can use some mindfulness. We call them top-down mechanisms, meditation. So you can use those to change the mind. So sure, keep doing that. Your breath, let's say your physical therapist tells you your rib cage doesn't expand, your breath is really shallow, and we need to calm that breath down. Your belly doesn't move anymore because your core, you've been told to keep your core strong. You've got we can get into that, I would love to, but you've been told you got to protect your back, and the core is weak. And so for the last 10 years, you've just been doing core exercises. You think, yeah, they help. And if I don't do them, my pain is worse, yet your back is still hurting. So you're doing those core exercises because you've been told you have to protect your spine. You're afraid if you let that core go, your discs are going to pop out. That all is creating more fear, and that messaging, and even your physical core where you're trying to protect and guard, you're creating more muscle tension. And we have research that shows people with chronic low back pain have an increased muscle tension around the core and bracing and guarding. A lot of it is the messages you're told from people like me, from physical therapists who are saying, keep that spine neutral. And we're so afraid. So the movement, we know now from the research how yoga helps, but how the movement, the flow, and the breath can help ease of movement. So back to the point about using any aspect of your existence to change any other aspect. You can keep it where it's linear, where you use the body to change the body, strengthen the muscles, relax the muscles, right? To help the muscles. Makes sense. And I'm sure most of you are doing that. And then you can use your breath. That was my last example I left on, where I was saying maybe your breath is kind of tight and short, expanding the ribs, or you're holding your abdominals in. That's that example I left on. So your abdominals, everything is really engaged and tight, and you're not able to relax. And you can do that right now as you're sitting here, everybody. You don't even have to look at me. You can just wiggle your jaw, your eyes. You can close your eyes if you want. And can you let go of a little bit of tension that you may be holding in the abdominals? And when you breathe, you can even put your hand on your belly. Can you feel the belly go into your hand a little bit as you inhale? So you're not sucking in. You're just getting out of your own way. Your hands on your belly. You're just breathing. Don't take a deep breath. Don't do anything. Just see if you can let go and breathe like you're sleeping. Use breath and just quiet, relaxed breathing, and just starting to see. So we can use the breath to change the breath. So I'm still linear, right? Use the body to change the body, breath to change the breath, the mind to change the mind. You can do some meditation. There's all kinds of different meditations, so many that can help calm the mind and peace. But here's what I want to share. So if you're kind of tired and I lost you there, this is where you wake up and you write this down. But the beauty of yoga is that you can use the body to change the breath. You can use the body to change the mind. You can use your body in physical movements to change your emotions. So if anxiety and fear, whatever you have, you can use different movements, whether they're flows, whether they're positions, and there's no cookie cutter. So that's the bad news I have. This book doesn't have, here's these 10 postures, here's these 10 practices. That's because that's not how pain works. But what we do know is that you can use the body, movement, positions to change your emotions, to change your breath, to change some of the maybe thoughts and beliefs you have about your pain and your relationship with it. You can then use your breath, and this is probably the most powerful bridge, and how one of the most powerful ways that yoga can help is through breath, and what other practices may not include. So you can use the breath, and there could be all kinds of different practices, but the breath can change the muscle tension. So your breath can change your body. We know your breath can change emotions. So in my book chapter on breathing and pain, we can see the evidence around when we change our breath. We can breathe in a way that increases our anxiety and fear. We can breathe in a way that calms us. And then that can change our pain too. We can use our breath to move with more ease, because if we're using our breath to calm the nervous system, because that's what happens when we use the breath and we prolong the exhale, or when we just slow it down a little bit, make it a little bit longer. So all of those breath practices of just simply slowing it down or prolonging the exhale, or even a paced rhythm of, you have to do a count that doesn't bring you anxiety. So, some of the literature will say 5 counts in, 5 counts out, but we see that no, that brings anxiety to some people. So that's why you got to do what works for you. But slowing the breath down, prolonging the exhale, and you can do that right now as you're sitting here listening, that can bring more calmness to the nervous system, which is wound up and one of the inputs into the system, which increases pain if it's wound up. So if we can use the breath to change the nervous system, that can change pain. That kind of gives you an overview of Oh, and there's meditation, of course, too. So you can use your mind to potentially can ease the tension in your physical muscles. And it's this, and all of it's the same principle of because it's making your whole physiology feel safe. It's making your physiology say, calm down and say, okay, well, I guess there is no danger. So whether you do that through movement, whether you do that through breathing, whether you do that through like a top-down approach, meaning you're meditating and you're trying to almost, I don't want to say convince yourself, but you're trying to just be that observer and know that you're safe in this particular position. That can also calm into the whole system. And so a lot of the mindfulness based stress reduction or any kind of mindfulness practice you may know of being aware of the breath or an open monitoring where you're just being aware of your surroundings, a body scan. So that's a beautiful yoga practice that I take people through, and I'd be happy, and I can take you through a couple practices that are really profound as your base. So the mindful awareness of doing a body scan, that in and of itself can change this whole hypervigilant system, which can change your pain. So that's kind of the how. And so when we do these talks, sometimes, people want to come away with like a practice, or they wanted the at least 3 or 4 different practices. And while I would love to take you and guide you through a couple, I think what's important to know that that doesn't exist, that there's like, here's these yoga practices, that are going to reduce pain. What it is more is these yoga practices and principles can influence your entire physiology, which influences the output, which is pain. So yoga, if you can kind of just another opportunity here to sort of shake your heads and just shake and get clear, because I know I'm talking a lot. This kind of like new paragraph, new page, new chapter. So let me just now take a moment to really clearly describe yoga. I've kind of done it in a roundabout way, but let me just say the word yoga means to unite or to yoke. That's like the Sanskrit, like yoga, to yoke. And it's uniting and yoking everything, every aspect of you, your body, mind, breath, spirit. We haven't talked about that yet, but it's basically connecting and being in union with all of that. It's an integrative type of a practice. Yoga, it's like 5,000 plus years old, and it's a philosophy, but it's a practical philosophy. And really what the roots are, um, there's different definitions or descriptions of yoga depending on which text you read. So this, having explaining to you all what yoga is, well, first of all, I'm still learning and understanding even after almost 40 years. Um, but really, I think the main thing is that you need to understand that it's a practical philosophy, and the essence of it is to help us be more present and aware of our being, and some people call it self-actualization. You may have heard that term, but it's to be clear of and aware and present, fiercely present of who I am, what I am. So it's an exploration and a journey of what am I? Who am I? And it's through that we then learn this insight or deeper insight into who we are and so forth, and then what we need and how we connect to ourselves, to others, maybe to nature or spirit or whatever word you use. And if you don't have words like that, it's just that idea of something, that feeling, that is your essence from when you were a little kid. It's just, it's not based on your age, your identity, financial status, job status. It's like, this is you. So it's connecting, it's remembering that. So this, I know this is like, what the heck? My knee just hurt, Shelly. Just give me some yoga poses and breathing. But this is yoga, right? We have to honor. So yoga is a deeper practice. And the reason why I think for the last several decades, it's just sweeping across in our traditional healthcare settings, like what I have done and so many of my colleagues, is because it's in line with the pain science, which is telling us you can use any aspect of your existence to change any other aspect. And there's really, I'm sure It must be out there, but there's no framework out there. It doesn't exist right now in our culture where you can look at the whole being. We've got pockets where maybe people now, if you go to a physical therapist, they may bring in some breathing practices. They may, the physical therapist may partner with a psychologist. And so the psychologist might do some cognitive behavioral therapy. We have some research around that with pain. Um, the physical therapist might do an awareness practice because in the pain science world, we're learning something called interoceptive awareness is altered with people with pain. And that's a body scan, my friends. So this is the non-yoga world. This is the pain science world that's saying, oh, that it's just the last decade, really, even less, like 7 years, where they're saying, oh, interoceptive awareness is altered with people in pain. Oh, these interoceptive awareness practices can help people's pain. And us yoga people are going, well, I've been trying to tell people that for 25 years. Can you imagine people like Neil and the yogis who been trying to tell us that for centuries? But so it's this idea. So when we go back to yoga, it's a practical philosophy, and it's really about exploring the journey of yourself, who you are, and being fully present and aware. Now, how we do that, that's where all the different lineages come in. So now we're getting into different types of yoga. There's many. So we're not, obviously, that's not what this is about. What I practice, I've learned some different lineages over the years, and I started with a particular one in the 90s. That book I read in my sister's bedroom and took, that was a certain lineage. But now, 35 plus years later, it's definitely, I don't subscribe to one lineage. So what I've done, and many of my colleagues, is I love integrating different yoga practices and principles from many different lineages and bringing them together. And the ones that we choose are the ones that are in line with the science. I mean, not always, that's being quite reductionistic, but in general, because I have to keep my physical therapy hat on and I have to stay within scope. So in my practice, in my physical therapy practice, when I'm seeing someone as a physical therapist, giving them physical therapy, I'm not going to be giving them things that are outside of my scope, like something with an energetic chakra or a chant or something. Nothing wrong with that. And I may do that in a yoga setting, but not in physical therapy. Okay, so let me just go back to wrap up this yoga wheel of principles and practices. So what Rodney's been waiting for. So I already spoke a little bit to how yoga helps, but I'll make it a little more clear. So we've got in this one model of the we call it, basically, I'll use some Sanskrit here just to honor yoga, the yamas and niyamas. And that's from Patanjali's Yoga Sutras. So it's one of the texts from thousands of years ago. And so there's basically different limbs. The yamas and niyamas are what we call the principles, and that's one or two limbs. And then the remaining limbs of this 8-limbed practice is from Patanjali's Yoga Sutra. The remaining limbs are these different areas in practice. So one of them, movement. Now in yoga, we call it asana, but as I said, when I translate this to people like yourself and trying to bring it in, how does yoga help pain care in our traditional setting? Well, we use movement. Yes, we might use some traditional yoga poses, some stretches, but again, there's no one stretch for, that's going to cure your pain, but we use movement. So I hope even just by me saying that, from what I've just said over the last 45 minutes or hour, you're like, oh yeah, I kind of get why we would use movement. That makes sense. We use movement. We use breathing. So again, I've already talked about why, I gave you that background, but that's the other limb, the breathing practices, and there's many different types. And then we also use awareness practices. That's the another limb. These awareness practices can be things like body scans or breath scans, and I can take you through, a brief, even just 1 minute or 2 minute of just scanning your breath or scanning your body. Okay. And I think I touched on it, and I know there's a lot in this hour, but basically there's science around, if you were to ask me, why again does these awareness practices help your pain? I could go into that even deeper, but I kept trying to keep it simple. So movement, breathing, awareness, and then meditation. That's another limb. So this is all yoga, right? So anything that you're doing, mindfulness practices, and then again, there's many different types. There's different types of meditation, but that can also change any aspect of your existence, including your nervous system and your physiology, which would then change your pain. And it can change your body tension too, and your muscles. And so it might make you move a little bit more easily. What happens if now you can move more easily when you're doing your exercises? Now your pain eventually might start to change because you're able to move more. You can do your exercises now without hurting, right? And so many people who have exercises for their pain or even stretches, maybe it helps a little bit, but not a lot, or maybe it sometimes makes it worse. That's the problem. And that's where yoga can help because I'm going to repeat again, because we can use our breath, our mind, we can bring all of this in as we're doing that stretch or as we're doing that movement for a more easeful experience and less pain, you see? So it's all connected. And then we've got another limb which goes into a little more, I think, than what we're going to be, what I'm here for today, but it does go into, in yoga, they call it samadhi, and it's that limb of the bliss and that flow. In contemporary science, they call it flow state. Mihai Csikszentmihalyi, if some of you've heard about that researcher, he discovered this idea. It's the brain changes, fMRI studies and so forth, where you're in flow state. And so we kind of loosely translate that, oh, that's samadhi. And that's that idea, like I said at the top of this call, where you feel just very expansive, or you feel how time just flies by. You're just in flow, and yeah, that concept of time kind of goes away. So you can kind of play with that and know that, yeah, that's part of the question. How does yoga help with pain? Well, yeah, even that idea of samadhi, even that idea of finding things in your life that bring you that joy, that bliss, that flow state can change your physiology, which might help change your whole pain system, which can change your pain and then make you move with more ease and recover the function and the movements that you want to in the activities. Return to your valued activities again. I think that I'm kind of just closing that loop of yoga and pain. And I guess, yeah, I'll just stop there and see. Gosh, I hope there are some questions about that and or clarifications or highlights. And anyone wanna, I would love to just hear, like, you said that and I've heard that before, and that just I'm gonna remember that. Like, yeah, little gems even. Anything surprise you? Or even if you're like, I'm just really overwhelmed, that was a lot. I wouldn't mind even hearing that comment, or like, that was just good. I need to rewatch the recording, like really just anything. I would like, because I have no idea how it's sitting for anyone. Does anyone want to be brave and just even say how it's sitting for you, how it's landing for you? Does any of this ring true? Sometimes people in pain will say, this actually kind of adds up. And it kind of makes a little bit of sense in my experience and why, my pain is so weird.
I think for me, Shelly, is when you're talking about yoga, and I don't know all the generic terms and whatnot, but sometimes I wonder, is it better to have static movement or
Hmm.
like flow movement?
Question. Yeah, great question. So these are going to be all my answers to anyone who asks, which you please keep asking me, but you know what it's going to be. It depends. Now, I can go on and give you some examples, a little bit of research, a little bit of my own experience in the clinic since 98. That's when I started being a physio. So static or movement. Okay, here's the thing. A lot of people with persisting pain, when you lie down, or it might not be lie down, sorry, it could be standing up, you're doing warrior pose, right? Or you're doing something. And if you're holding it, often what can happen, the whole nervous system, everything just kind of tenses up, and your breath and for your mind, everything just, ugh. Now, if you've been doing yoga for a while for your pain, guess what the practices you would have, the foundational practices you would have already have done at rest in a relatively comfortable static position, maybe lying down, but not for everyone. It might be sitting or reclining or standing up, maybe with your back against the wall. So some supportive position that's most comfortable for you. You practice breath awareness. You'd practice body awareness, which is the scan. So this is not, you're not changing anything, you guys. You're just being aware without trying to change. That's awareness practices. And maybe you do a mind awareness like a meditation. So you've already been practicing that. And then you do regulation practices. So there's a difference between awareness and regulation. Regulation means, okay, now I'm going to see if I can do something to change my experience. So that's where you would bring in the longer, smoother, softer breath pattern, or the belly breath, or the alternate nostril breath, like you name it. So there's all these different breathing practices that you've already would have learned. See, it's a process. You see where I'm going with this? You don't just, here's this yoga pose, like you got to learn the layers. So then you learn this regulation breath practice that seems to be useful for you. And then when you do that pose, now Shelly gives you this pose. It could be one that's more like a stretch. Let's say you're laying down and it's for your hip, and so you want to do this certain stretch for your hip. Or maybe it's more of a standing pose where you do this stretch with your shoulder. You hold static, as you said. We use the pain care guidelines that's based on what yoga tells us, what the pain science tells us, what clinicians have told us over the years of working with people with pain, and what the people in pain have told us. That's where these pain care guidelines have come from. They're called pain informed guidelines. So you're in that position. The first thing that we do is we say, is this dangerous? You have to believe that, yeah, this is okay. And if you don't know, that takes practice and time. Is this safe for my body to do? Right? If you know, yeah, I know this is safe, I might flare up or whatever, but I know there's no tissue damage. I know I've had this for 6 years, it's a nagging pain, but I know I'm not damaging my tissues or my joint. If you don't know, and if you think, well, I don't know, maybe well, then you can back off a bit. But you find a position where you think, okay, I can handle, but it's got to be an edge, right? You're coming up to that edge of pain. And then you ask yourself, will I, have a flare up? Like, will I pay for it later? And as you know, you might not know right then and there, but that's part of yoga. That's the process. And pain science tells us that too, that we have to explore. That's how you have to do it. So you ask those two questions and write those down, you guys. Is it good? Is this safe enough for me to do? Do I feel safe enough? And will I pay for it later? And then you do these three things. You bring in the practices that you already would have learned, the yoga practices of keeping your breath calm. There's yoga practice number 1. Can I keep my breath calm? So you have to learn that, right? It's not perfect. I'm not saying you have to master it. And number 2, can I keep my body tension low? Again, can you just do that right off the bat when you're going to your edge? Maybe not. You might have to learn it in the other sessions. But the idea is, are you guarding somewhere? So if anyone right now has a certain position that they know is their end, you can even do that. Go to your end and make sure you feel safe. And then when you're there, okay, that's good. Now, has your breath changed when you got to that edge? Can you comment? Did you guard? Are you bracing somewhere in your jaw? Your toes, are they gripping? Do you feel something, right? Muscle tension. That's the yoga of it. So now we're saying, okay, what can you let go of that you don't need for that stretch? So that's the process. Oh, and the third one is then, of course, monitoring your pain and all the experiences. So you don't ignore your pain, but you're not like hyper fixated on it. So you got to learn that too. This is a process. So to your question, Georgie, static or movement, static can be useful. It depends on the person. So on one hand, though, in my experience of all these years, I'll say the static, the person in pain with that nagging back pain, shoulder pain, like just chronic pain, the static seems to, I hope you're okay with this, but it seems to piss off the nervous system when you're holding. And I think it's because like You just overdo it, and it learns it and it knows that's hurt, and you just keep doing the thing that hurts. If you can learn no with a guided, professional or something, if you can learn to do that edge differently with these yoga practices, then you might have a more easeful experience. So you see, I'm not writing off the static positions. I'm just saying my experience is the flow and the movement. It just seems to be more calming. And we do have some research with rhythmical movements. It's more with the neck and like because you've got these different apparatus like in the neck, chemoreceptors and different things in the brain. But it seems like some rhythmical movements, and actually even in the trunk, there's some new research that comes out. So movements of the trunk, so flexion of the spine, extension, rotation, side bending. So think about that. Your spine, that's what you do the cat cow. Most people know that. So moving that spine in those different directions seems to be a pain reduction technique. Now, of course, you might be thinking, that makes my pain worse. Are you kidding me? Well, that's where you got to use the pain-informed guidelines. Maybe it's on your hands and knees and you start to move the spine a little bit. Or maybe it's in sitting and you move the spine. Or maybe you have to stand and just move the spine, right? And not like the keeping the core and everything stable. Like I'm talking about moving the spine, right? So, and just a little bit. And so that's what I love to Georgie's question. I find, and the research finds that movement helps to calm the nervous system, which decreases threat into the system. Remember, we're trying to decrease danger into that system. And what else does movement do?
Relaxes the tension for sure.
Yeah, the muscle tension, yeah.
Mhm.
What else can movement do? Remember what I said at the very beginning? You can use any aspect of your existence to change any other aspect. So movement can maybe a flowy movement, maybe something in the emotions. So we know that emotions, and that's what we do with yoga. We'll use emotion. What expression can give you more joy? Open up, expand. People with pain, rigid, right? Braced. So can we open up? Open up.
Yeah.
So that might shift your emotion, or and this is where you have to work one-on-one, like a warrior poses, very strong. So a warrior pose, you're standing strong, move it a little bit,
Yeah.
and I agree with you, Georgie, because I've seen it with my patients. It allows the muscles to let go a little bit more if you can kind of just move them versus just holding. Sometimes what's really valuable is contract, relax. So you might be in a certain end range or position, and you might want to contract your muscles and then exhale and relax. And then contract your muscles, jaw, shoulders. Oh, I do encourage everyone, just do that right now. So shoulders up to your ears, your biceps, your fists, your jaw, clench your face, and then exhale, let it go. And do that one more time. Squeeze, face too, fist, face, scrunch your face, jaw, and then shake it out. And you can do that throughout the whole body. But even that experience, just doing that, like I feel totally different. Like I just completely, like I feel totally different. And there's blood flow and stuff too that's happening. So yeah, I do like the flowy movements. Again, not vilifying static though. So I hope I got that point across if you can do
Yeah.
the static properly. But we are just even with your language at the beginning when you had said, Georgie, and you had shared, and this is, I'm not picking on you, this
Yeah.
is what's out there, is people talk about stretching, and they'll say, I do my stretches and it's that idea, and I'm going to use this again, you've got that nagging neck pain and you learn from the physio and then you hold. And that's great. If that's working for you, do it. Just don't listen to anything I say after this. Like, just do that. But as you know, it doesn't help a lot, right? Or it makes it worse, or it kind of helps and doesn't. So that's where we can now move. And by the way, oh, this is important. It doesn't mean you got to move that part. You do something with your legs, your feet. And that's what I love about yoga. So do something that doesn't involve this and move your whole body. Yeah. yeah, or shoulder. Let's say you got that nagging shoulder rotator cuff thing. Oh, it's just off, on and off. And okay, let's move. Let's do some whole body yoga poses. Move, flow, warriors up. If that kind of hurts, okay, use the pain informed guidelines. Go to my edge. You may need to just stop moving a little bit just so you can, okay, ooh, there's that edge. Okay, just take a second. Am I breathing calmly? Am I holding? Oh, yeah, my toes were clenched, my jaw was clenched. Calm your system down. Okay, now. Oh, wow. Oh my gosh, my shoulder feels way better, you know? And it might not. I'm not saying it's all magical, but it's a process. So that's this idea of yoga, which, as I hope what you get from this is like it's not just the movements or the poses, it's the breath and everything. And we, of course, didn't get into yoga, like the principles, and there's different ways to frame how you're moving. And, but it's all in the book. So, if you are really interested in this, the book has a lot of value in that. Do you want to guide through just a breath awareness practice, or we don't really have time for that? What do you want to do?
Well, I think just for time's sake,
Yeah.
I would love to, and you and I, like, I know our paths have crossed today, and we're gonna stay connected. I really appreciate all you.
Yeah, and I can give you, would your membership, would all everybody here, would they like some links, like for just some free links to like a breath awareness and a body scan? So those that want to maybe try it, then they can do it on your own time.
Yes,
Would
I
that be okay? Well, I'll do that, Georgie. Then I'll send you some links, and you can look at them. You can play with them, and then if you don't mind, I'm also going to send you a link because I have practices. So it's we didn't even talk about self-compassion. Maybe we have to do a second one next year, or whenever you have space to talk, because this is very a huge part of yoga. Is that's one of the principles is self-compassion, and we have research around how self-compassion can help reduce pain and other aspects of like anxiety and why it does. So maybe can we do one maybe whenever I know you're busy or full, maybe next year or whenever you can to talk just about self-compassion and pain.
yeah,
I would love to do that.
yeah, that
Um,
would be great.
but I do have a practice on, or it's a series of four, they're four classes. So they're guided and it's self-compassion and pain care. So it's basically a yoga class. So to those who kind of want more, or you're thinking, okay, so how does yoga, help it? I do have four classes of yoga practices, much of what we just talked about here. It's called self-compassion. So it's with the foundation of self-compassion. So I can share that one. That is a paid one, but I can give you 50% off. And if anyone can't afford it or whatever, just email me. And, I don't want money to be a barrier, but it is how I make a living. So I would appreciate, any kind of support there if you've got that resource within you. And then what else? So I'll send you the free guided practices, the self-compassion and pain care yoga classes. And that's all I can think of now.
Sure, and I'll share your website as well.
So it's
Your yoga.
physioyoga.ca. I can put that in the chat if you'd like. And then also, when I send you the email, Georgie, you'll have my website, and that's how you can contact me, is just right through there directly.
Right.
If
And I
anyone has
have
any.
sent that out to everybody as well. And I just wanted to also say that you're still at Summit in Red Deer, correct? As a
Yeah, in
physiotherapist
Sylvan Lake. In Sylvan Lake,
in Sylvan Lake.
actually.
Okay. Okay.
That's right.
Hey,
Okay. Can I read something to you all? It won't take long, but I just want to close with this poem. All right. Everybody, this is for you. My wish for you, and it's genuine, each and every one of you. Now, I don't know each and every one of you. This is from my bottom of my heart to all of yours. I hope tomorrow morning when you wake up, you will see the light in everything. And not only in the sunrise, but in the places that are harder to find, like in the hallways where you are certain you are only passing time, and the gritty gold dust flooring between the floor and the blinds, and every little thing that catches your eye. I hope tomorrow morning when you wake up, you will see the light in everything. And
Thank
that's a
you.
poem from Morgan Harper Nichols. So thank you for your attention. I hope you all learned something, and please try the practices to calm your systems down after listening to me being all over the place.
It was fantastic. I learned so much, and I'm so grateful to have you join us here tonight. And like I said, I wrote this down. We will connect again, Shelly, for sure. And there's so much more that we can talk about as well. So thank you, everyone, for joining us tonight as well. And we don't have a guest speaker in July, taking July off. And we do have, I have it here, and you know her, Shelly. And it's funny, it's you guys are back to back, but it's Adrienne Van Gool, and it's going to be The Journey of Self-Care to We Care. And when I read this book last year, it really spoke about the nervous system. And I was in awe because I wasn't, I was getting some panic attacks, but was not really thinking about the nervous system. I was like, why is this happening to me? And it kind of explained to me why things happen in our body. And yeah, so that's going to be in August. I believe it's August 24th, but I will let you guys know the date and everything in an email for sure. Thank you. Before we go, is there any other questions for Shelly before we say goodbye? No, I think we're good. Thank you everyone for joining us. I've seen some names. I did see my participants now. I appreciate everything and everybody. And Shelly, thank you again. And I just feel like saying namaste.
There you go. The light in me bows to the light in you. Yeah, that's beautiful. Thank you for your attention, everyone. I really hope you learned something and it's useful for you.
Yes. All right. Good night, everyone.
Good night.
Thank you so much, Shelly. That was wonderful.